Hello my people, how are you? Welcome to a new video. I am Dr. David Campos, and today we are going to talk about V.A.C therapy. I know that many of you have heard, others have not. So here in this video, I'm going to talk about V.A.C therapy, what is it used for, and show you some images of how this therapy is used. Before starting this video, well, don't forget to leave a like, subscribe to my channel, and obviously share this video with everyone. And don't forget to follow me on my Instagram, which I'll leave here for you, so we can stay in touch more and you can ask me whatever you want. Let's start with this video. Many of you might be wondering, what is V.A.C therapy and what is it used for? Or what is V.A.C therapy, also known as vacuum-assisted closure therapy? It's a non-invasive and dynamic system that helps promote healing by applying negative pressure at the wound site, thus favoring in the affected area the elimination of excess fluid, stimulating angiogenesis. The goal of V.A.C therapy, as it is known, is to accelerate the healing of complex wounds. According to Food and Drug Administration approval, V.A.C therapy is indicated in patients with chronic, acute, traumatic, subacute wounds, burns, also ulcers, and for diabetic patients as well. In this video, I'm going to show you some images and videos of how the V.A.C therapy device is placed for patients. Here, for example, we are going to see a patient who is diabetic. Where? Well, you know that diabetics suffer a lot with circulation and do not have good healing since the blood flow does not reach the very distal parts. And this happens mostly in the feet, and here we need to speed up a bit what would be the healing in patients. V.A.C therapy helps us a lot because it is an excellent treatment to save time. After debriding a wound, because it minimizes secondary infection, facilitates the formation of granulation tissue, and cleans the wound before definitive surgical closure. This V.A.C therapy is not bothersome or uncomfortable for the patient because with this therapy the patient does not need to be hospitalized. It is a device that can be carried and used at home. The treatment will depend on the doctor who is administering the V.A.C therapy. It can be between 15 days, 20, 21 days, depending on how one wants that treatment to go. There may indeed be some irritation or discomfort in the patient, since that is under pressure and all that. It is sucking up all the fluids and bacteria, anything that might be in the wound, so it can cause a little discomfort. But it's not something that could cause much discomfort to the patient that needs to be removed. In clear cases where there is a lot of pain, they should go to the doctor to have it removed from the therapy. But this helps a lot since you have given back a lot to patients who are diabetic and have slow healing. Well, this helps a lot since it saves time and since you're not constantly... The patient avoids going 2 to 3 times a week for treatments. So here this V.A.C takes care of suctioning and also creating granulation tissue and speeding this up for the patient. So is it a good alternative? And here I leave you images and videos so you can see how it works.
Well, we make the connection in the canister, which would be the reservoir that has a gel where the secretion is going to fall and solidify. A kind of gel that has no smell is wrapped. So then we have here the pressure that we are going to maintain. At 110 millimeters of mercury, the vacuum pressure that can go to the device is up to 120, depending on the characteristic of the wound. If we want, we lower a little bit or raise, we lower to 100, we maintain at 110. Then according to the machine we press for it to start sucking. And here we already have the pressure without leakage because the device did not sound the alarm. And if we look here at the device, it already has its 110 millimeters of mercury of suction. When the pressure drops, the device activates and starts suctioning. We already have it sealed. The patient's wound, I put a date here for him to return about 15 to 20 days. The little device is working well. We still don't have secretion aspiration because it's a wound with scarce moderate output.
I sincerely hope you all really enjoyed this video. See you in the next video, and if you have any questions, just ask me. See you, bye.